What to do during a heart attack? A step-by-step guide. A heart attack is a scary experience that can be life-threatening if not addressed quickly. It's crucial to know what to do during a heart attack to increase your chances of survival and minimize damage to your heart. In this video, we'll provide a comprehensive guide on how to respond effectively to a heart attack, including how to perform CPR and use an automated external defibrillator or AED. We'll also share some simple steps that you can take immediately to help prevent permanent damage to your heart. So watch this video till the end and don't forget to subscribe. Understanding the symptoms of a heart attack. The first step to surviving a heart attack is to recognize the signs and symptoms. The most common symptom is chest pain or discomfort that feels like pressure, squeezing, or fullness in the center of your chest. This pain can last for a few minutes or come and go. Other possible symptoms include shortness of breath, cold sweats, lightheadedness, and nausea. It's important to note that not everyone will experience all of these symptoms, and some people may not experience any symptoms at all. That's why it's important to be aware of the less common signs of a heart attack, especially in women, as they may differ from the typical symptoms. Signs of a heart attack in men and women. While chest pain is the most common symptom of a heart attack, women are more likely to experience other symptoms such as shortness of breath, nausea, vomiting, and back or jaw pain. This is because women tend to have smaller blockages in their arteries, which can cause different symptoms than the larger blockages that cause chest pain. It's important for both men and women to be aware of all the possible signs of a heart attack so they can seek medical attention right away. If you suspect you or someone else is having a heart attack, don't hesitate to call emergency services. It's better to be safe than sorry. What causes a heart attack? A heart attack occurs when the blood flow to the heart muscle is blocked, preventing oxygen-rich blood from reaching the heart. This blockage is usually caused by a buildup of plaque in the coronary artery, which can rupture and form a blood clot. The clot can completely block the artery, causing the heart muscle to become starved of oxygen. This can lead to the death of heart muscle cells and permanent damage to the heart. What is the first step during a heart attack? The first step to take during a heart attack is to remain calm and not panic. While this may be easier said than done, staying calm can actually help slow your heart rate and reduce the strain on your heart. Take deep breaths and try to relax as much as possible until help arrives. It's important not to try to drive yourself to the hospital, as this could worsen your condition and waste valuable time. Instead, call 911 or your local emergency number and stay where you are. Emergency services will be able to provide medical assistance much faster than you can drive yourself. Calling emergency services for a heart attack? As soon as you or someone else starts showing signs of a heart attack, it's essential to call emergency services right away. Every minute counts when dealing with a heart attack, and early intervention can save lives. When calling 911, be prepared to provide your exact location and a clear description of the situation. If possible, have someone else call while you begin first aid. Even if the person seems conscious and talking, don't assume they'll be okay. A heart attack can quickly become life-threatening, and delaying medical attention can have serious consequences. Chewing aspirin for a heart attack. Chewing aspirin can be helpful during a heart attack, as it can help thin the blood and prevent the formation of blood clots. This can help restore blood flow to the heart muscle and reduce the risk of further damage. However, it's important to note that aspirin should only be used as a temporary measure until professional medical help arrives. You should chew one full tablet of 325 milligrams of aspirin, then wait for emergency services to arrive. It's also important to keep in mind that not everyone can take aspirin due to allergies or other medical conditions. If you're unsure whether or not you can take aspirin, it's best to err on the side of caution and not chew any. Calming yourself during a heart attack. When going through a heart attack, it's crucial to try and remain calm and manage your anxiety. Easier said than done, right? But here are a few things you can do to help calm down. Firstly, try taking slow, deep breaths to help regulate your heart rate and blood pressure. This can help reduce the strain on your heart and allow more oxygen to flow through your body. Secondly, try to distract yourself from the situation by focusing on something else. This could be something simple like counting backwards from 100 in increments of 7 south. This can help take your mind off the heart attack and reduce your overall stress levels. Lastly, if you have someone with you, ask them to reassure you and remind you that help is on the way. Having emotional support can be incredibly helpful in managing a heart attack and reducing its severity. Best position during a heart attack. If you're experiencing a heart attack, it's important to find a comfortable position that can help reduce the strain on your heart. Generally, sitting upright in a chair with your back supported is a good option. This can help improve blood flow and make it easier to breathe. Another good option is lying down on your left side, which can help reduce pressure on your heart. However, if you're experiencing shortness of breath, you may want to stay upright. Ultimately, the best position is the one that makes you feel most comfortable and allows you to breathe more. Just remember to stay put and wait for emergency services to arrive. CPR for a heart attack. If you or someone you're with goes into cardiac arrest during a heart attack, performing CPR can be like CPR helps pump blood throughout the body, providing vital oxygen to the brain and other organs. To perform CPR, start by placing the heel of one hand on the center of the chest and the other hand on top. Interlacing your fingers, then press down hard and fast at a rate of 100 to 120 compressions per minute. Aim for a compression depth of at least 2 inches for adults and 1.5 inches for children. It's important to note that CPR should only be performed if you've received proper training. If you haven't, it's still important to call emergency services and follow their instructions. They may be able to guide you through the process over the phone. Using an AED during a heart attack. An automated external defibrillator, or AED, can be life-saving during a heart attack. An AED is a portable device that delivers an electric shock to the heart to restore its normal rhythm. If you or someone you're with is experiencing a heart attack and doesn't have a pulse, it's important to locate an AED and use it as soon as possible. Most public places like malls, airports, and schools have AEDs readily available. If you find an AED, follow the instructions and apply the pads to the person's bare chest. Then press the shock button if prompted. Even if the person's heart has already stopped beating, it's still important to continue CPR while waiting for emergency services to arrive. Heart attack recovery tips. Recovering from a heart attack can be a long and challenging process, but there are some tips that can help you along the way. First, it's important to make lifestyle changes that promote heart health, such as eating a balanced diet, exercising regularly, and avoiding tobacco products. You should also get plenty of rest and manage stress through relaxation techniques like yoga or meditation. Additionally, it's crucial to follow your doctor's recommendations for medication and treatment. Remember to attend all follow-up appointments and don't hesitate to ask questions about your condition or treatment plan. With the right mindset and support system, you can recover from a heart attack and live a fulfilling life. Foods to avoid after a heart attack. After a heart attack, it's important to make dietary changes that can help prevent future issues and promote overall health. One of the most important things to avoid is processed foods, which are often high in sodium, saturated and trans fats, added sugars, and refined carbohydrates. These foods can contribute to inflammation and increase the risk of another heart attack. Instead, focus on incorporating more fruits, vegetables, whole grains, and lean proteins into your diet. These foods are packed with essential nutrients and can help improve overall health. Additionally, it's important to limit your intake of cholesterol and red meat, as well as alcohol and caffeine. By making smart food choices, you can help ensure a healthier future. Heart attack prevention habits. Preventing a heart attack involves making positive lifestyle changes that promote overall health and reduce risk factors. One of the most important things you can do is to eat a balanced diet that's low in saturated and trans fats, cholesterol, and salt. This means choosing healthy sources of protein, such as fish and legumes, and incorporating plenty of fruits and vegetables into your meals. Regular exercise is also crucial in maintaining good physical health and reducing the risk of heart disease. Aim for at least 150 minutes of moderate-intensity exercise per week. Additionally, it's important to maintain a healthy weight, as obesity increases the risk of heart disease. If you smoke, it's important to quit, as smoking damages blood vessels and raises blood pressure. Finally, it's essential to manage stress through relaxation techniques like yoga or meditation, as chronic stress can contribute to heart disease. Daily routines for heart health. Incorporating these daily routines into your life can help promote good heart health and reduce the risk of heart disease. Start by getting at least 30 minutes of moderate-intensity exercise every day. This can include brisk walking, cycling, or swimming. Exercise helps maintain healthy blood pressure and strengthens the cardiovascular system. Additionally, be mindful of your diet and aim to consume a balanced mix of fruits, vegetables, whole grains, and lean proteins. This can help reduce the risk of obesity and other risk factors for heart disease. It's also important to maintain a healthy weight and avoid smoking, as these habits can significantly impact heart health. Finally, manage stress through techniques like deep breathing exercises or meditation, as chronic stress can contribute to high blood pressure and other cardiovascular problems. When to visit a doctor for chest pain. It's important to seek medical attention right away if you experience any type of chest pain, even if it goes away quickly or you don't think it's a big deal. Chest pain can be a symptom of a heart attack or other serious cardiovascular event, and it's always best to err on the side of caution. If you're experiencing chest pain, don't hesitate to call emergency services or go to the nearest emergency room. Don't try to diagnose yourself or wait to see if the pain goes away. Prompt medical attention can help identify the underlying cause of your chest pain and provide timely treatment. We hope you found this video helpful and informative. Please don't forget to like and share for more health and wellness tips. And if you have any questions or comments, please drop them below. Stay healthy and take care.